The picture of youthful health as they enjoy an after-school visit to the park. Nellie Wishnia and her sister Selma are among millions of American children who are no longer eligible for a COVID vaccination this autumn. The US Food and Drug Administration has only approved the new shots for people with at least one high-risk health condition and those over 65.
We have a pediatrician and pharmacy where we'll be able to get it. I'm more concerned for some of the other populations where maybe it's not as easy to get to a pediatrician or a pharmacy. And so, the families wouldn't be able to have immediate access to the vaccines.
It is very scary because we are already seeing some results in some states where families resist the vaccines and they have part of the population being contagious with the measles and kinds of things. And so I am a little bit concerned that that's going to spread out across the country.
This guy gets a lot of respiratory kind of things. So we always vaccinate, and we plan to continue doing that, and hopefully we'll be able to do that this fall. I don't know what will happen in the future, though.
It's the latest move by Health and Human Services Secretary Robert F. Kennedy Jr. to restrict access to vaccines, which he has long opposed. As the school year begins again here in the US, new data is showing that routine vaccinations for kindergarten children are declining, while at the same time, exemptions from school-required vaccines are increasing, particularly those for non-medical reasons. That's according to health policy research organisation KFF. Members of the federal government who've spoken out have found themselves out of a job. CDC Director Susan Menares was fired after accusing RFK Jr. of weaponizing public health.
Secretary Kennedy for many years has been a voice for the anti-vaccine movement. So he's got his own pride rolled up in this proposition. And that, as a result, has resulted in a lot of prejudice against sound scientists and facts and figures that he simply sees as not supporting his proposition. I fear that when it comes to vaccine issues, both science and policy, Secretary Kennedy is ignoring the science, he's ignoring the facts, he's not being collegial.
The turmoil could expand beyond the US's borders and impact public health globally.
Secretary Kennedy's actions are going to result in fewer government dollars cloud into both basic research and translational research when it comes to new types of technologies and thinking relative to vaccines. And that impacts the entire world. Because if U.S. cuts back on research, that's really the lion's share of research that's been done.
The long-term consequences of RFK Jr.'s disruption of the US's health system may not yet be clear. But when the dust settles, it's likely that it won't just affect Americans, but people across the rest of the globe too. Kate Fisher, CNA, Washington.